All set.
Good afternoon, everyone. This is our City Council work session with the Department of Recreation and Human Services and their Crisis Intervention Department. So we'll be hearing about the different programs that they offer, including the Person in Crisis team and the Homicide Response team. And it's something that I'm very excited about, and I think this will be very informative. So with that, I will turn it over to Commissioner Dr. Shirley Green.
Thank you for having me today. We are excited to be here to share with you some information around the Crisis Intervention Services. And I'm hoping that you can all see my screen.
We can.
And I will get started. So today I'd like to introduce our team, the team that I have with me. We're going to talk about Crisis Intervention Services Unit, and we're going to talk about the PIC dashboard. So today I have with me Sarah Fletcher, who is the Deputy Commissioner for the Department of Recreation and Human Services, Aaliyah Hinton-Williams, who is the Manager of Crisis Intervention Services Unit. We also have with us today as our members of the Office of Human Resource Management, just in case there were questions around human resources that we were not able to answer. So as Vice President Lupien mentioned, there are 3 units within the Crisis Intervention Services. Those 3 units are the Homicide Response Team, the Person in Crisis Team, and the Community Support Team. So what I'd like to do is just go through each of these teams with you. The first team I'll talk about is the Homicide Response Team. This is a team that is comprised of staff and volunteers. The team responds to homicide scenes. They provide mental and emotional support for family members, neighbors, and the community during a homicide that would have taken place in that area. They also provide follow-up care. So as you can imagine, with a homicide, it's not just what happens at the moment, it's what happens after the fact. And so this homicide response team also does follow-up care. The coordinator of this particular team is Aaliyah Hinton-Williams. She has members of the clergy represented by Pastor Melvin Cross. We have a social worker assigned to this team who works within our department, Leslie Ogden Gordon. And then we have community service providers. We have members from Rise Up Rochester, Rochester Gun Violence Coalition. We have a clergy response team. Pathways to Peace supports this initiative. We work with the County of Monroe and their FIT team, as well as SERVE and RIT. In addition, with the new changes with the Office of Neighborhood Safety, we also have members of those team members who could participate with us during a homicide response. The second team that falls under our Crisis Intervention Unit is Community Support Team. This is a team of employees who work with us here in the city of Rochester. We currently have 6 full-time staff and 2 part-time staff. Within that full-time staff, we do have a supervisor who leads this, the community support team. The services that the community support team provides include victim assistance and counseling services. The way we can be accessed through the community support team is through intake by phone or walk-in. We also have requests from RPD to respond to family and community crisis, where they could have those family members or residents called directly to the community support team. The community support team provides access via phone or in person, as I mentioned. We are currently operating Monday through Friday from on Mondays from 8:30 to 5:30. Then on Tuesdays through Friday, we now have hours from 8:30 to 7 p.m. This is an additional time within community support services. And we also now hold Saturday hours from 9 to 5. As we know, the community has a variety of needs, and sticking with a set schedule of 8 to 5 may not meet the needs of our residents. So we have made those adjustments to have evening hours as well as hours on Saturday. As well as calling us, we also have opportunity for walk-in services. And then the third team, which as Vice President Lupien mentioned, is probably one of her most, I don't want to say favorite teams, because then you have people who say, oh, she likes us over us. But this is one.
We don't want to play favorites.
Right. So this is one of the teams that stands out for Vice President Lupien, where she has expressed interest. So Person in Crisis, which we know as PIC team, is a 24/7 operation. We provide services on 3 shifts, 7 a.m. to 3 p.m., 3 p.m. to 11 p.m., and then we have 11 p.m. to 7 a.m. And these are all staffed by trained professionals. The PIC team was created to address mental and behavioral health and other related crises that our residents face on a daily basis. They respond independently to low acuity calls, and I'll talk about that in a minute. But they also the partnership with PIC and Rochester Police Department allows for PIC to be called by RPD if they are not initially dispatched, as well as if PIC is on a call and they need support, they can also reach out to RPD. And what's important to note about that is over the course of the year when the team was first initiated, that was something that has been important to build a partnership between Person in Crisis and RPD. This team is comprised of 13 full-time emergency social workers. As you all know, part of the budget was to increase our Person in Crisis team from on-call to full-time persons. So this has been a shift that we now are staffed for 13 full-time positions. We have 2 of those 2 positions where we have newly assigned supervisors to support the shift work. I will go back to the 13 full-time. Within that 13 full-time includes 2 bilingual emergency response social workers. Then we have 5 part-time, 10 on-call, and we also have a clinical supervisor. And so the clinical supervisor was already a position we had, but the new positions, as I mentioned before, are the new emergency response social worker supervisors and the addition of full-time staff. You may also wonder about the reduction. We used to have about 30 on-call social workers, and we reduced that to 10. But the rationale behind that is if you have a full team staff and they have regular hours, you need less on-call social worker, response social workers. The rationale again falls into if needing some of those folks, because we know that people will be out for sick time or vacation time. So that gap could be filled with those 10 on-call. We also increased the number of part-time employees so that we can have some overlap in shifts. We can have some overlap in support needs that we may have out in the field. PIC team is assigned to work in teams of 2. So on all of the shifts, there's always working in 2. And so if you look at that morning shift, you will have 2 teams of PIC employees out and about during our day shift, our evening shift, and then we have 1 team out doing our evening shift. The coverage, again, includes 24/7 call response, and we are limited to the city of Rochester. So PIC only responds to calls within the city of Rochester. So the call types and how we're dispatched is important to note. So we are currently dispatched by 911 or 211. I just want to put a plug in that many of you also may know, we are moving to a 988 system for mental health and behavioral health. And so that will be added to a possibility of who else could dispatch us. But right now we're working with 911 and 211. So as I mentioned about low acuity calls, which could be PIC alone calls, which are screened for no weapons, no violence, no injuries, no active crime scene. Why is this important? Because the safety of our employees. We do not want to dispatch our employees who are not trained for weapons, violence, and those types of things. So low acuity calls are what PIC could be dispatched for independently. The types of calls that we are currently being dispatched for has been a variety of calls. As you all know, it started with a focus of mental and behavioral health. Because of the needs of the residents in the Rochester area, those calls have granularly changed from just mental and behavioral health. PIC calls can include domestic violence, homelessness, substance use, wellness checks, youth-related incidents where a youth could be engaged in something and need the support, family and neighborhood intervention, neighbors not getting along, family members not getting along, death. We are also being called for PIC if there is a death in the family that may not have been a homicide, but the family needs outreach. And then, of course, anything that happens in the community that is raised at a level of a crisis, PIC can also be dispatched for. And when I show you some data, you'll see the breakdown of some of these types of calls.
Dr. Green, would you like questions held to the end? Or can you accept them?
I will
throughout?
take them as you want to ask. I'm okay with that.
Okay, I do have a question about the call codes here. Are these at the intersection of kind of crisis where either, you know, there's a homelessness call where the police get to the scene and they feel like there's a mental health component and will dispatch PIC, or is PIC getting dispatched from 911 for these types, regardless if there's a mental health component?
I know Aaliyah is on the call, so Aaliyah, I'll ask that you can add on. But what I will say initially is, if the call went to 911 and they got there, our PD sees that it is a mental or behavioral health, they will call for dispatch for PIC to come. But Aaliyah, anything else you want to add to that specific question?
No, that is correct, Dr. Green. It is usually related to a mental health or behavioral health crisis before it's just a homelessness call. There is other protocols in place to address what's considered just homelessness.
So these are primarily the calls that PIC is getting dispatched to by kind of the police get on the scene, but the mental health, kind of the 25 card, that's still a co-response from 911.
Yeah.
Got it. Thank you.
So I'll go on to the next slide, which talks about the dashboard. And I mentioned about looking at data. Data is very important as it drives decision-making and it tells the story. And so what we have, we went live in June, I believe it was, with our data dashboard that can be accessed, and I will pull it up in a minute. But the data that we are collecting is the needs of PIC. Why are we being called? What are the outcomes after PIC has arrived on scene? Calls by referral type. And that's the referral source. That's whether it was a 211 call or a 911 call. Response types, time of day, and then the demographics. And we think it's important for you to see that information. And so I'm going to try to pull up the actual dashboard. And again, let's see. Can you all see that now? Yes, okay. So here is the person in crisis dashboard that is accessible for community residents as well. It is on the city website. But if you look at here, it tells you the type of call, the outcome of the call. So if PIC went on a call, what was the outcome? Did the individual remain on site? Were they transported to the hospital? Was they transported to another community site? Did they decline PIC services? This chart over here talks about the calls or the referral source. And so if you look here, 211, if you look at that, 61 calls were from 211. I'll back up. This is for the month of June. So our data dashboard starts with the previous month. So we're in July, so you will see data from June, and then I'll show you year-to-date data as well. But right here, it tells you how many calls for the month of June were from 211. And then if you look here, 693 of the calls were from 911. Down here talks about the response type. Were they PIC alone calls or were they co-responding calls? So looking here, we had 87 calls that were PIC alone. And then when we look over here, we had 214 calls that were co-responding. This chart over here just gives you an idea of the busy time of the day. So this is by time of day. And as you can see, that morning shift from 9 to 11 at night is our busy time. And so that's where we do have 2 teams out in the community from PIC. The next item on the dashboard talks about the needs. Why were the calls made? What was the need of the resident? And so as you see, there were 270 of the calls for the month of June were mental health crises. Those were our residents that were experiencing mental health crisis at the time of the call. Substance abuse, family or other relationships, medical crisis, suicidal ideations, abuse, self-harm, and other. And so these are the reasons we were out in the month of June. This chart right here changes on a monthly basis because it depends on what the call is logged as. This chart over here is by zip code. We try to track zip code. You see unknown. That's some data cleanup we have to do to make sure we're tracking the right zip codes. As I mentioned previously, we only service in the city of Rochester. And so we have to do some cleanup with those zip codes. Down here is the demographics that I talked about. We keep race, age, and gender. I do want to note that race and gender and sometimes age is what someone may have perceived it to be, because we may not always get that exact information from a client. So you can imagine if a person is in crisis, then we're not going to struggle with them to find out what do you classify yourself as in terms of gender or race. And so that decision is based on the person who provides the service. And so we asterisk these specifically because we can't say 100% that these are the correct races, age groups, or gender of our clients. But it's important to note that we have some idea of those demographics. And so that's why we do capture that information. Page 3 of the dashboard starts with year to date. So if you look up here, this data is from January 22 to June of 22. So this is a 6-month period. And so we keep the year to date on the dashboard as well. So some people may want to say, well, what did we do this month? And then want to look over the course of the year, how are we doing? And so as you see that same data is collected, but this just gives year to date. And then this last chart shows the same demographics as well as the need and zip code, again, from January to June. And so with that, I leave you with opportunity for questions at this time.
I have a question. Is there any data around folks who have called the PIC team and ended up being arrested?
Aaliyah, I'm going to ask Aaliyah to answer that question. Do we have any of that kind of data, Aaliyah?
Yes, it's on the dashboard.
It is listed as, let me go back to that.
The person was arrested.
Okay.
It's a potential outcome of a PIC call, so it's an option.
Okay, thank you. That's helpful. Thank you both. Thank you, all three of you. Thank you.
Is there a differentiation between like a mental health arrest versus a criminal charge? There's, yeah.
Yes, sorry. So we differentiate between arresting and going to jail and arrest and going to the hospital.
And so I'm just going to pull up that screen again, because that's a good question, but I want you to see it. Hold on. So if you look at the outcome over here, it talks about individual was arrested, transported to another community site, remained on site, or transported to the hospital. So those are listed there as those outcomes. And if I look at year to date, so June, there were 2 individuals were arrested. If I go to year to date, there were, so far this year, there were 7.
And when it says arrested, that's to jail. Because mental health arrest would be to hospital. That makes sense.
Yes, correct.
And do we, I know other outcome was in there. Is there a breakdown of that somewhere?
So when we first put this out in June, that was a big question. And so we have since reduced that, and we will continue to reduce that number to get clarity on it.
Great. I have a question around the role of peers, and forgive me if you already talked about that, but I know that there's some kind of permanent peer positions that you guys have added.
So peers was a grant that ends in, I believe in September. And so in October, we are bringing on 1.5 FTEs for peers. And that's the same work that they were doing through the grant, but this will give us an opportunity to hire them as city employees with the same expertise that they came with through lived experiences that will help with follow-up.
Thank you. And Councilmember Gruber has some questions. Oh, but he's having some connection issues. So go ahead, Councilmember Martin.
So going back to the homicide response team, I wasn't clear about how many people work on that team.
So, okay, so let me just pull my page back up for you.
Thank you.
So the homicide response team, as I mentioned, is majority of volunteers. So for staff purposes, we have Aaliyah, who coordinates it, and then we have Leslie Gordon, who is a member of our PIC team. So those are our staff. The remaining part of the team is volunteers. We have clergy response team. We have members of Pathways to Peace, Rise Up Rochester, Gun Violence Coalition. So those are all volunteers who, when Aaliyah does an outreach after a homicide, and she can speak more to this, she does her outreach to see which volunteers are available to come to the scene.
Got it. Thank you.
I have some questions surrounding that as well. Is Mitch back on? No? Can I jump in there?
Yeah, go ahead.
Thank you. This is surrounding the funding sources for the victims of crime. State covers quite a bit of it, but I hear that people are paying out of pocket for things that are not afforded. Are we running out of funding for that? Is there somewhere where the county and or city can augment some of that funding?
I'm going to let Sarah start, and then if Aaliyah wants to add to that.
Yeah, so we actually just were re-awarded a 3-year grant from the Office of Victim Services. As a New York State grant. You all will see that in August. So we're excited about that. So that does fund a lot of personnel. That group assists people with the New York State Victims Compensation application, which Aaliyah can speak to more. But we did have an agreement with Rise Up Rochester for this past year to provide more wraparound services for victims of violence, a lot of relocation funds. We're working with them and the county to make sure that victims are receiving the assistance that they need. But Aaliyah, if you want to answer the questions about the New York State Victims Compensation applications.
So Councilman, are you referring to funds for victims homicide victims specifically?
Right, victims of crime in general.
Well, okay, so the funding for victims of crime and homicide victims comes from the state. So they do have criteria and parameters around that funding. So when people apply for it, they do have to meet certain types of criteria, and there are certain things that the state does not allow funding for. So for an example, if you talk about a homicide case, the state will pay up to $6,000 for service arrangements, and anything over that outside of what the county contributes, because they also have a $3,000 fund that is available to families. But for certain items, for example, if people want a horse and carriage.
No, no, sorry, not, yeah, nothing like that. What I mean is, if they saw the crime happen and they want to be, they want to show up in court in order to be the eyewitness. When we put them in safe houses, when we put them in hotel rooms, do we establish cameras on the perimeter around their home? Is there funding for all of that already in place?
Well, if someone is a witness for the state, then the district attorney's office should be paying for them to have whatever it is that they need. OBS does not necessarily provide funding for that because that's a different type of circumstance.
So will it always fall under state parameters, or if it's a city murder, let's say?
What if it's any kind of a murder and someone is a witness for the state needs to be taking care of that person's needs.
Are there instances of people paying out of pocket for hotel rooms, let's say?
There might be, but those may not necessarily come to us because that would be a different type of a scenario. But if there are safety issues, people just in general, something may have occurred. Sometimes people have had a family member killed and then they're concerned for their own safety. We are able to, with our partners, provide them with some type of safe housing and a safety plan for how we can address what might be occurring.
Okay, and a different question here regarding rec centers. Are we increasing video camera capabilities at these rec centers and splash parks? I mean, it's summertime, that's when most of the shootings occur. Are we increasing the availability of keeping an eye on what's going on outside of our rec centers?
So we do have cameras at all of our rec centers. We
Right.
are working on, there's a governance committee led by Deputy Mayor Patrick Cunningham, where we are constantly reviewing what we need to add. Are we making sure that they are working? And so all of that has been discussed currently in all of our centers. Our centers have those cameras in place. Upgrades and more lighting, those are continuous conversations we're having with the governance committee.
Okay, and are we working with RPD or some type of law enforcement to do like an audit for, hey, this area right here is not covered by the 2 cameras that are facing that area? Are we doing an audit to make sure that we are pretty much hitting all of our property at the rec center to make sure that if something were to happen, we would have some form of evidence to show it?
So RPD and emergency management is on that governance team. So all of the key players are there, including IT, security, because when you talk about the cameras, we need the IT support to make sure we're doing that. So all of those members are part of the team, and those are the conversations that we continuously have.
Fantastic. Thank you very much, Commissioner, and Ali as well. And Sarah.
Welcome.
Mitch, are you back online?
I am, thank you.
Great.
Thanks for the presentation, everyone. Just a couple questions. I guess that my first one is, if you could just give a little bit of an overview of how things are going in terms of the partnership with the county. You talked about there being collaboration with FIT over there, and I'm sure there's other ways that these different groups interact with the county. Just if you wouldn't mind sharing a kind of highlight of how things are going with that relationship and maybe an area of improvement, I'd love to hear about that.
So, Councilmember Gruber, that's a great question. Since I've been joined the team, I've had a number of meetings and conversations with Dr. April Aycock, who leads the FIT team. We have had conversations around how each department is adjusting to meet the needs of the residents. As you know, FIT can service outside of the city, but even in the event that something is happening in the city and we need the support of FIT, they have been supportive working with us. We are working with FIT on how we can do more supports in our rec centers using some of the services that they provide residents. And so I would say that the partnership certainly has, in my opinion, in my short 6 months, been very successful, very collaborative. When we're looking for a creative way to do something, we reach out to them, but vice versa. We've both shared our dashboards to see what data each other is collecting. Is there better data that we should be collecting so that when we come out, we're all coming out on the same level? And so that has really been helpful. We continue to have those conversations, and FIT originally was not a 24/7 operation. They are now 24/7. We've had conversations with them about why we have gone 24/7 and the benefits for them. And so they've learned some things from PIC and has made some changes. When we were talking about our on-call positions not being full-time, had a conversation with them about, you know, this is how we're operating. Their feedback and suggestions around why we should consider full-time was part of that conversation as well. So I will say that Dr. Aycock has been a true partner with us. And we, I know Aaliyah meets with her probably on a monthly basis, or her and Sarah. I don't meet with her as much, but when I do, it's a very collaborative partnership.
That's really great to hear. Sorry, go ahead.
Well, I was just going to add to Dr. Green's response and say that
Aaliyah, you're it looks like you're talking, but we don't hear you, or is it just me?
can everybody hear me? Oh, okay. I think it's just you, Commissioner. Sorry. The county and the Crisis Services Unit have collaborated wonderfully over the past couple of years. The FIT team and the PIC team collaborate. The FIT team and the homicide response team collaborate. Myself and Dr. Aycock meet on a bi-weekly basis. We also partner on community education and outreach. We sit on several committees together. So there is a consistent and intentional partnership that has existed since before the PIC team started. The county was at the table and worked with us intensely on starting crisis services and specifically the PIC team. So we're very proud of that work, and we anticipate that it will only grow and become better.
I'll say also really quickly too, we also collaborate with DHS on the victims assistance work to making sure that we're spreading as much funds as we can for victims of violence as well. And that's a really good, we meet on a monthly basis to discuss victims of violence. So that's also going really well.
That's really great to hear. I'm sure I'm preaching to the choir on this, but obviously I think we all know the future of this work and the effectiveness of this work really all does hinge upon the way we're able to work in collaboration between city and county. I would also add probably between, in some ways, the hospital systems as well. But certainly it's a great thing that there's so much communication flow between the different teams. So kudos on that. My other question that I want to ask is just about the data question I just asked. But you know, Commissioner Green, you talked about the importance of data and shared a lot of data with us, which I really appreciate. My biggest concern, honestly, is that we collect so much data as a city and as a community, and data is only good if we know what we're measuring and if we are really able to share it well in intentional ways. So I'm wondering if you can just comment on the way that this data ultimately gets shared back and forth with Office of Business Intelligence at RPD, with some of the work that Victor Saunders and his team are doing, and I'm sure they're collecting a whole bunch of data as they get moving. What's the data sharing process? How's that going so far?
So in terms of the data sharing, we really have more conversations with 211 and 911 in terms of this data. In regards to, have we shared it with Victor's team or other teams? We have not intentionally done that. The dashboard is available for everyone, but I think that's a good point for us to think about. Who should we meet more frequently to have conversations about the data?
Or I'd also point to Nick Petiti in RPD, who I think has done a really good job of making himself who's been done a really good job of making it clear that there's a lot of room for improvement in the way the city utilizes data, mostly with the focus on RPD. But obviously, the police department, these departments that we're talking about here, and of course, Victor and his department are all ultimately working on a lot of the same issues with different approaches. And to the extent that Nick can use some of his expertise to make sure that data is shared widely across different departments, I'd really, really recommend maybe having a conversation like that.
Thank you for that, and we'll certainly follow up on that.
Thanks, that's all for me.
Can I ask about the PIC Advisory Committee? Any updates on that, how that's going, and how community members can continue to get involved?
So, Councilmember Martin, we had a meeting, I believe it was in June. And so I shared with that committee that the advisory, when you think about an advisory, they're giving you advice on how to do something. And when I looked at the documentation around the development of the PIC of Crisis Intervention Services, the advisory team was created to help get it set up. And so we've been over a year now into that process. And so what I said to the advisory committee, you know, what they want was data as well as sharing information. Members of the advisory team meet with either Aaliyah or Sarah almost on a monthly basis. And so those folks will continue to do that. And what I said to the advisory team is we will come together again in December to make some decisions on where we need to go. But the meetings are really not about advising any advisory information. It's more about us sharing information. And prior to the June meeting, the data was not available. And now that data is available for the community. And so, and many members of the advisory committee was in agreement that we don't need to meet as frequently because they already meet with Aaliyah and Sarah. But certainly come December, we'll gather again and we'll have more updates then.
Thank you. And for clarity, there's still a group that meets that's no longer called an advisory committee, but they meet with Aaliyah and Sarah monthly?
So the members of the advisory team, and there's AMR, there's 911 representation, there's 211 representation, there's mental health experts that are represented on the team. And so all of those people are still meeting with Aaliyah on a monthly basis for their specific needs. It's not something that everyone has to be in the same room to talk about. So when AMR has an issue, they're working through that with Aaliyah. When we work, Sarah meets with the folks from 211, that team, regularly when we need to clean up data or we have questions. And so all of those people have an opportunity to meet with Aaliyah and Sarah as, like I said, monthly. Aaliyah mentioned some bi-weekly, but it's about what we need to do to get better at our work. There was one member of the community who did not feel connected to any of these other larger bodies. And so we did commit to that person that we would meet with her as needed. So she really had questions about how things are going, but we will make sure we meet with everyone in December. And this particular person, we did schedule a meeting with her to see what we could do to meet her needs. Aaliyah meets with mental health experts regularly. Maybe we can connect her with that group that Aaliyah already meets with. And so certainly we're not trying to exclude anyone. And so if someone wants to get information more frequently, we are certainly here to do that.
Commissioner, you know, I know you know that I was also on that team, and that council is not represented on the group that meets with Aaliyah monthly. But we will, Councilmember Harris and I were the ones assigned to that, will be included in the December group. And I know that Councilmember Harris is also chair of the committee that houses the legislation that comes through, and she meets with you on a monthly basis. But But if there's any further information, certainly I think that we could either call a work session or have a special meeting to discuss that.
So, and I would be open to that. I don't want to speak for Councilmember Harris, but certainly we do meet monthly for dries pieces. But if there's ever something that needs to come up, that I would be willing to share that at our regular monthly meeting as well.
Thank you, Dr. Green and Vice President Lupian. I have had a great relationship with Commissioner and her team. We've met a couple of times in regards to drive in particular PIC. We did talk briefly about this upcoming work session, and she assured me that the dashboard would be up and running and displayed during this work session. So I'm very thankful that her and her team, Aaliyah, Sarah, everybody's done a lot of hard work, and all the other team members in getting this going. I'm happy to see that you guys have expanded your team. And I'm looking forward to seeing all the great work that comes out of the PIC process and, collaborating with all the partners. One thing in particular I'd like to ask about the dashboard is, will that be updated monthly at a certain time or a certain date?
So we've had that conversation, and we're trying to, we talked about like the 5th of the month, because at the end of the month, you have to clean your data, scrub your data before you post it. But as soon as we get a firm date, we're going to also add that on the dashboard to say updated if it's the 5th of the month, so people will know.
Thank you. Thank you.
Welcome. You're welcome.
Are there mechanisms for feedback from people who have received services from the PIC team? Or the crisis, or any of the crisis intervention units?
I will let, it looks like Sarah was going to respond. Go ahead, Sarah.
Yeah, that's a great question. So we're working on a survey process. It's something that we've discussed that we do need to roll out and kind of talk through in terms of both getting feedback from PIC, people who have interacted with PIC, and then also the victims that we work with the community support team. So it's something that we're rolling out.
Thank you. And for the 29% of calls where it was just PIC team members responding without a co-response from RPD, could you walk me through how those happen?
I'll let Aaliyah answer that question.
Thank you.
Councilmember Martin, what happens is that we may get the call. If we get the call through 211, they have received the call and have assessed that it is a PIC call. They will call us directly and give us the information regarding the call, which includes all of the details around what is occurring, who's involved, and a snapshot of what the needs are. And because that call has been assessed to be safe, we're then able to create a job with 911, because they have to be aware of where we're at all times. So even if the job comes from 211, it still has to be processed through 911. So they'll create a job, and then we're able to go and respond to that call on our own. If we do arrive at a scene and we find that there are some safety concerns, we are able to call and have 911 come out and join us as a co-response. If the PIC alone call is generated through 911, they also provide us with the details, and they are aware of where the call is, so they already have created the job there. And again, we just respond on our own, and we still have the option of requesting a co-response if necessary.
Great, thank you.
You're welcome.
Are there any other questions?
Yes. So with the victim assistance services, some calls we've gotten are people have had gunshots go through their door or window. Are there services for people who have had that happen? Is there a number to call, funding for that?
So absolutely there is. That is where our community support team comes into play. I know Aaliyah has the Oh, here's the phone number. Yes, it's a phone number, 428-6630. So anytime a family has any concern, something has happened, and we have not gotten the report, anyone can always call 428-6630, which is the community support team, to seek services.
That is amazing. Thank you so much, Commissioner.
You're
Green.
welcome.
If there's no other questions, I think we will say thank you so much. This has been really helpful and informative, and we'll see you next time.
I'm glad that we were able to help you. And anytime, let us know.
Thanks to everybody.